So it's now my distinct pleasure to introduce Doctors David Galland and Paul Anderson, who wish to welcome you on behalf of their the larger institutions they represent. Dr. Galland is the George R. Minot Professor of Medicine at the Harvard Medical School and Dean for Research Operations and Global Programs. And Dr. Anderson is the K. Frank Austin Professor of Medicine at Harvard Medical School and Senior Vice President for Research Education and also the Chief Academic Officer. I think David's going to speak first. Thank you, David.
Well, thanks, Peter, and good morning, everyone. It's a great pleasure to be here. I'm really delighted to add my warm welcome to this wonderful 20th anniversary celebration of the Osher Center for Integrative Medicine at Harvard Medical School and Brigham and Women's Hospital. Peter has alluded to some of this, but I wanted to briefly recount the timeline of the transformational collaboration among HMS, the Brigham, and the Osher Foundation. Now at the 20-year mark, our Osher Center is one of the longest standing and most impactful integrative medicine centers in the United States. In 2001, the Osher Institute and the Division for Research and Education in Complementary and Integrative Medical Therapies was established at HMS as the result of a generous gift from the Osher Foundation. The Institute and Division were founded and led by David Eisenberg. I'm delighted to see you here today, a visionary faculty member at HMS and the Harvard School of Public Health. In 2007, the Osher Foundation generously provided a second foundational gift, this time to the Brigham, to establish the Osher Clinical Center for Complementary and Integrative Medical Therapies. This center has been expertly led for the past 14 years by Don Levy, who I'm also delighted to see here today. In 2012, these two terrific entities came together with a new vision to form the Osher Center for Integrative Medicine at HMS and BWH, and a national search found the perfect director in Galland, who I'm also delighted to see here today. The new Osher Center was and still is a center without walls, with a mission to form strong links for integrative medicine, researchers, educators, and practitioners throughout HMS, the Brigham, Harvard University, and the other HMS-affiliated teaching hospitals and research institutes. Helen embraced this vision with passion and implemented it at a furious pace. She rapidly built and consolidated our integrative medicine community and developed education, research, and clinical programs across the spectrum of biomedical science and medicine relevant to integrative medicine, diagnostics, therapeutics, and prevention. In fact, Helen was so successful that she was recruited to the NIH in 2018 to head the National Center for Complementary and Integrative Health. And that brings us to the present day. After masterfully filling in as interim director of the Osher Center during a national search for Helen's replacement, Peter Wayne has now been appointed as the new director of the center. And if anything, Peter's vision is even more exciting, since it builds on Helen's work to establish our magnificent center without walls. Peter's strategic plan is a masterpiece of planning for the continued growth of the center in its core areas of research and education, with close links to clinical care. I'd like to close by making some observations about the tremendous research and education being done in the Osher Center. The center's mission is very well aligned with that of both the medical school and the Brigham. Perhaps the most prominent and important attribute of the center is its commitment to rigorous research, which spans the translational spectrum from fundamental research on basic mechanisms to clinical research, clinical effectiveness, and implementation. This research not only informs the evidence-based interventions delivered to our patients and is disseminated broadly to our providers and policymakers. Importantly, it also enables bridge building across departments, disciplines, and institutions across our integrative medicine community. The collaborative and interdisciplinary research led by the Osher Center's faculty and supported by mechanisms such as the center's pilot grant program have high potential for innovation and impact. Finally, I want to express my profound gratitude and that of Harvard Medical School to Barney Osher, Barbara Osher, Mary Bitterman, and the entire Osher Foundation, not only for their gift, but also for their vision. None of this would have been possible without their partnership on this incredible journey. Thank you very much and enjoy the rest of the symposium.
Did you raise it for me? Thank you, Peter.
I shortened it for myself. How's that?
Wonderful. Well, good morning, everybody. It's my great pleasure to be here today to meet with you and to talk about the tremendous success of the Osher Center over the years. As Peter said, my name is Paul Anderson. I'm the Senior Vice President of Research and Education at the Brigham and also the Chief Academic Officer. And it's my privilege to share with David Golan oversight and support for the Osher Center over the last 8 years or so. It's really great to see Barbara Beer here. Barbara and David actually launched this on the administrative side probably 10 years or so before I got here. And obviously Barbara has played a tremendous role in this as well, so thank you, Barbara. I could not be more proud of the center's many accomplishments over the past 20 years. It's my particular pleasure to have had the opportunity to meet Mr. Osher and Mary Bitterman this morning. I've heard so many things about them and been so grateful to all of your support, but it's really a great privilege to get to meet you finally. Now, my involvement in the center began during the Helene Langevin era, and it's great to see Helene here today. She's been a wonderful steward of integrated medicine and played a particularly important role in enhancing collaborations between Osher investigators and Brigham collaborators, and also collaborators at many other institutions. And so it was not really surprising that she became a target of the National Center for Complementary and Integrative Healthcare, and is now serving as their director and doing really amazing things. So thank you, Helen, for all that you do. Peter Wayne was a natural selection for Helene's successor, given his accomplishments in multiple areas of integrative medicine, and as well as his vision for what integrative medicine could be and what it should be. And I can tell you that his promise is being fulfilled. We're really grateful, Peter, to everything you've done in the last couple of years for the Osher Center. I'm also particularly proud of the Osher Clinic that resides at the Brigham, and which provides our patients with innovative therapies that improve their lives daily. And importantly, the clinic is now being managed in a financially sustainable manner that will ensure that these therapies will continue to be available for our patients in the years to come. And I'll just close by again thanking the Oshers, Dr. Bitterman, for their support and vision, without which none of this could be possible. So thank you all.